Hello, friends. I'm Dr. Sritama Banerjee, and I'm back again with a new video. This time, I shall be discussing about how to keep your heart healthy. First of all, I would like to mention that please like, share, and subscribe to my channel, and do let me know in the comment section about your feedback. Now, coming to the topic, how to keep your heart healthy. Now, Uh, what are the risk factors for heart disease? Firstly, there are two types of factors. One is the non modifiable factors, about which we cannot do anything, and one is the modifiable factors, about which we can do something. Firstly, coming to the non modifiable, it is important to know uh, coming to the race or ethnicity. Indians are more likely to suffer from heart disease at a less age. Most of Indians suffer from heart attacks and they are below 40 years of age, which is strange, is it not? In Western world, people, the average age of suffering from heart disease is much more than in Indian population. However, we cannot do anything about it. The next non-modifiable risk factor is age. The risk of heart disease is more in males greater than 45 years of age and in females greater than 55 years of age. And coming to the next factor, which is the gender. It is commonly seen that men are more susceptible to heart disease and the risk factor is more in men. However, in females, before their menopause, they are more protected against heart disease because of their hormone estrogen. However, after menopause, estrogen quantity is less and this protection is not present. So, after menopause, females and males have the same chances of having heart disease. Now, coming to the factors which we can do something about. Coming to the modifiable risk factors. The first is blood pressure. Now, what is our blood pressure? It is the pressure with which the blood flows in the blood vessels. Now, if there is high blood pressure, or which is also known as hypertension, it is a risk factor for heart disease. Next is diabetes or increased blood sugar. Patients of diabetes are more likely to suffer from heart disease. Next is dyslipidemia, which means the serum cholesterol levels are altered or defective. It generally means increase in LDL and decrease in HDL and also increase in triglycerides. All these are risk factors for heart disease. Now, there are other risk factors which include increased body weight. If the body weight is more, these people are more susceptible to heart disease. Then there are certain bad habits. For example, alcohol consumption, smoking. All these are extreme risk factors for heart disease. Enough of serious talk. Now, coming to the most important thing which you have been waiting for. What can we do to prevent heart disease? What are the tips that you can take from me to protect yourself from heart disease? First one, focus on your diet. Obviously, you have to avoid junk food, fast food. You have to avoid excess oil, excess trans fats, or saturated fat. You must take healthy diet and you must also take diet at appropriate time. Now, what relationship there is between time and diet? There's a very important connection because if you take diet at the appropriate time, then the diet will be easily digested and metabolized in the body. and then it will be easily absorbed and utilized by the body. However, if the timing of the diet is not correct, then the body will convert all the excessive diet into fat, and that will get stored in the body, resulting in conditions like obesity or excessive fat accumulation in the body, which will again be a predisposing factor for heart disease. Now, what are the appropriate timings of the diet? Breakfast. There's a saying, very important saying, which is very prevalent in the Western world, especially. Eat breakfast like a king, eat lunch like a prince, and have dinner like a pauper. Which means you should have heavy breakfast, so much that a king has. You should have moderate lunch like a prince, and you should have light dinner like a poor person or a pauper. Now, when is the appropriate time to have breakfast? You should have breakfast within 1 to 1.5 hours after awakening from sleep. And then the appropriate time for lunch is around 12:30, 1 in the afternoon, and appropriate time for dinner is around 8:30, maximum by 9 p.m. in the night. And you have to have at least 2 hours between your dinner and your sleep. Immediately after dinner, you should never go to sleep. Now, coming to the next important point, that is, you have to have regular physical activity to lose weight. Now, what do you mean by appropriate regular physical activity? That is, you have to have brisk walking or cycling or say treadmill or jogging or swimming or some exercise which will help you to sweat. You must sweat daily. That is appropriate physical exercise, and this kind of exercise you have to do 30 minutes daily for 5 days in a week. That is 150 hours in a week. You must do such exercise which will help you to sweat. That is the meaning of regular appropriate physical exercise. So that will enable you to lose weight, which is going to help you protect against heart disease. So we have covered 2 points. Coming to the next point, you should have adequate sleep. Now, what does adequate sleep mean? Medical research says that it is necessary to sleep for at least 7 to 8 hours a day. Okay? So you however busy you are, you have to sleep for 7 to 8 hours a day, because that will enable the body, all the cells of the body to rest, and all the repair and wear and tear of the body cells and tissues are going to regenerate and again accumulate energy for the following day. So that is also going to help you to protect against heart disease. Now, coming to the next point, certain bad habits which you have to leave, which are addiction like smoking and alcohol. Smoking, it has been seen, medical research has shown that the persons who quit smoking have had so much benefit for protection against heart disease, which has outgone all the prevention of all the modifiable risk factors together. So, quitting smoking is extremely important in the prevention of heart disease. Also, you must quit alcohol. Certain scientists say that a moderate quantity of red wine is good for the heart. However, such medical research has not been substantiated by adequate evidence, and I am not a supporter of this opinion. So, in my opinion, you should all quit alcohol to protect against heart disease. Next, you must find techniques to reduce stress. Now, you have to admit that there is stress in daily lives, whatever profession you may be in, be it doctor, engineer, or any other profession, or be in household activities also. There is stress, there is tension, there is anxiety. However, you have to avoid taking all the blame on yourself. You have to avoid taking stress. So, I can suggest some stress busting techniques. For example, you can read good books, you can pursue a hobby, whatever you like to do, you can listen to good music, you can spend quality family time, you can also do some explicit stress busting techniques, for example, mindfulness and breathing relaxation techniques. Now, what is mindfulness? It is non judgmental watching of your thoughts. You close your eyes, you breathe deeply in and out, and you watch your thoughts, the thoughts which are going on in your brain constantly. You watch them without judging what thoughts are coming. So it is known as non judgmental watching of your mind. So, this is a technique which helps in reducing stress. And also, I have to advise you spend quality family time, keep some hours for family members, eat with them together, travel with them, enjoy with them. All these are going to help you to maintain a healthy heart. And you must avoid being overweight, and the ideal BMI which you have to maintain is normal BMI is 18.5 to 24.9, and for that you must do regular exercise and you must maintain a consistency in all these practices, and you have to treat the modifiable risk factors. For example, if you're a patient of high blood pressure or hypertension, you have to have drugs, antihypertensive drugs, and you must take them constantly. It's not like you take it for 2 days and your high BP falls and then you stop them. It doesn't work like that. Once you start a medicine, you have to take them regularly, as and when the physician tells. You must follow the physician's instructions. If the physician gives it for your lifetime, then you have to continue for your lifetime, and you must follow the clear instructions of the physician. Same with diabetes patients. If you have high blood sugar or diabetes, you have to continue with the medications. And if you have high blood cholesterol, then you have to take your medications. That is, you have to get yourself treated for all the modifiable risk factors for heart disease. So, if you follow all these tips of mine, then it will surely help you go a long way to have a healthy heart and a healthy life. Have a good day and stay happy, stay safe. Bye bye. I shall be back with another new video. For the time being, goodbye and good day.